here for wellness exam. Are you experiencing any pain, any abnormalities going on right now?
No.
Okay. So my hands are a little cool. So, just want to kind of assess your level of consciousness. Let's give a baseline for, you know, if something changed, I would be able to detect a difference. So when I asked you these questions, that's why. So just give me your full name.
John Roman.
And a date of birth.
1872.
And where you are right now.
Florida.
And who's the president?
Barack Obama.
Okay, great. So, right here I'm just checking for dehydration. So if you were dehydrated, your skin would actually tend up. Okay. I'm also now just feeling skin temperature, looking at your skin, making sure there's no abnormalities, any kind of lesions or bruising, anything. Make sure your hair texture is good, no loss, anything. Okay. Landing is also leave up a little bit. Once again, it's your skin. Everything looks great. You want to go ahead and lay back down on the bed. Patient's pleasant, appropriate, no skin lesions, level of conscious everything, oriented ×4, speech is clear, no obvious issues. So the next thing I'm going to do is listen to your heart. I'm going to do some palpation as well. Okay. I'm just looking at the chest. Symmetry, you're not barrel-chested, anything that would indicate, like for example, somebody that has COPD, they would be very barrel-chested and everything, your dynamometer is good here. So now I'm just feeling for the apical pulse, which is basically right at the bottom of the left ventricle, and I'm just trying to palpate that to see if there's any abnormalities. It should just be a light tap. I'm actually having a little difficulty feeling it, so if you could turn to your left a little bit. It's on the bed, or I'm sorry, to your on my left. So that way I can feel better. Okay, so everything feels normal. It should just be a light tap there. So now I'm going to listen, and what I'm listening for are the different heart sounds over your different valves. So the first one would be the aortic, the pulmonic, something that's called Erb's point, the tricuspid, and then the apical pulse. Sounds good there. No extra long sounds, just the normal love dub sounds of the heart. So next thing I'm going to do is I'm going to assess your lungs. So the first thing I'm going to do is just watch you breathe. Just breathe normally. your respiratory rate is 16, and that's normal for an adult. Your breathing is not labored. It's not shallow, real deep. You're not struggling to breathe. You're breathing with ease. And so the next thing I'm going to do is check for symmetry. So I'm just going to put my hands here on your stomach, and then if you can take a deep breath for me. Again. So all I was doing there was I had my hands placed like this, and I'm looking for symmetry when you breathe, which is what you want. You don't want like anything to be asymmetrical. Okay. So then the next thing that I'm going to do is I'm going to check for something that's called tactile fremitus, which would be if like your lungs are air filled, and if they're consolidated, which would be having like any kind of fluid or pus in them, you'd be able to detect that with this. So as I move my hands down your chest, I just want you to say 99.
99, 99, 99, 99, 99.
And all that's doing is there's a feel of vibration, and it's consistent throughout. There's no increase or decrease as I move down. So I'm going to have you sit up. I'm going to do the same two things to your back. Sit here. Okay, same thing. Take a deep breath for me. Again. Okay, and then 99.
99, 99, 99, 99, 99.
Okay, sounds good. The next thing I'm going to do is percussion. Actually, I'm going to stand it back here. So I'm just going to lay my hand on your back, and I'm going to be using my finger. It's called percussion, and I'm just listening to the sounds I'm going to get. I'm going to do it in multiple areas across your back, kind of in a ladder formation. So the sounds over your lungs should be more resonant. Sorry. Going all the way through the lungs down to the bases. And I'm going to do that again on the front here. And then, just going to listen. Just breathe regularly for me right now. And take a deep breath. Another one. Okay. Normal sounds of lungs, it just sounds hollow like air. If there was any kind of fluid or mucus, pus, any kind of infection, there would be sounds, coarse, crackly, like when, an example would be like when you crunch snow, that sound, you can kind of hear that in lungs that are wet. So right now your lungs sound just a hollow air. You can take a deep breath for me. Again. Again. have you lay down again. I just want to look at your neck, your jugular, and your carotid. Normally, I would have you at a 30-degree angle, but this bed doesn't move that direction, so we're going to act like it's at a 30-degree angle. So all I'm doing is looking at your carotid artery, and then also on your jugular vein. So if you can turn your head either direction is fine. This here is just looking for any kind of distension. And then see, you turn again. Okay. And then the next thing I'm going to do is I'm just going to feel for your pulses. So I'm going to feel here for and I'm going to do them both at the same time. Make sure that they're symmetrical, they both feel the same. When we grade them on the scale of 1 to 4 plus, and yours both are feeling a 2, which is normal. 1 would be like a weak, and 4 would be like a bounding, where you could actually see it bulging out of the skin. Now I'm going to feel for your radial pulses. Capillary refill, which when I push on your finger, it goes from the normal pink color to white.